So today is kind of a big day. I have decided to seek help for something that has been an issue since I was 7. And something that a lot of people don't know about me because it is a little embarrassing and makes me very vulnerable, but it's real and it's my life. I can remember as far back as when I was about 7 and I was getting ready for school. I'd sit down at the kitchen counter next to my dad who was eating cereal. Could not sit next to him because I couldn't handle the sound that he was making eating it. It just kind of grew from there. People eating salad, people eating popcorn. Honestly say when I go to the movie theater, I can hear people eating popcorn 3 rows back. If I can't leave the situation or the environment that I'm in, I just feel like I'm gonna go crazy. Thought it was time to see if I can seek out something that would help me manage it a little bit better. So I found a place that I hope will help me. I've never done anything like this before. Interesting.
So this cap, it connects to the computer, so it shows like different brain waves and all the different sites on your...
What if it doesn't show anything?
Then your brain's completely great.
Well, it's not because there's an issue.
Right.
So these are your eyes in the dark. It almost drifts a little bit to the right and then bounces back to the left. It's generally a problem with the vestibular system where one side's pushing too much and the other side's not. So I'm gonna do a lot of things to try to fix that. Or tilted your head to the right, so right ear to right shoulder. It actually gets worse. You notice all the dual tasking stuff is tough for you.
Yeah.
So saying something while you're doing something else.
Is it tough for everyone?
Not everyone.
Okay.
To be honest. And so this should be working all the time, but now you have what's called like a limbic reaction. So the limbic system is your emotional brain, and that's deeper in here. And so you have a poor connection between these guys. You started developing this poor habit, this poor neuroplastic process when you were 7 years old, or maybe earlier. And then it's gotten worse throughout time because this habit is now there, it's present, it's just gonna keep going.
Is it genetic? It's not something I did?
No. So
it just develops.
It just develops. How I'm going to treat you is I'm going to try to fix this and try to fix that.
All right, so yesterday I had my 3-hour neurological test with Dr. Nick at the Neurologic Wellness Center, and it was super interesting and insightful. And today I am starting my treatment. It's 12 days, an hour a day. Apparently he knows the root of the problem and how to make it better. So we will see. Thanks for coming along on the journey. Okay, day 1.
You're holding your head, and I'm just going to slowly move it to the right, and then you're going to get on the right side. And that part is going to come out. Okay. Let me know when you feel it. I said I wanted to activate that left cerebellum and the right midbrain, right? And so what this is going to do is going to lower your heart rate. It's a little to your left, okay? So the RPSS was the repetitive peripheral somatosensory stimulation, and that is the prongs. And there's 3 branches, B1, B2. Those 3 all help with decreased inflammation, headaches. We also did the one on your wrist, which is the median nerve. They all go up into that same brainstem area, which is where your autonomics is. That's kind of where like rage can come out of. Mm-hmm. Then we did the breathing. And so we worked, rather than just the belly, we worked into the sides of the abdomen. The complex movements, I can do them. So these things, okay? Cerebellum is what coordinates thoughts, emotions, and actions. And the gyrostim, we just spun you to the left. That is the most powerful vestibular activation we can have, besides going up into all those structures, the limbic system, which is the emotional brain.
How does that happen by just me spinning?
You are spinning and nothing is moving.
Yeah.
And so your brain knows you're spinning, but it's not getting any canceled input from your neck.
Right, I just finished my first therapy. Super interesting because it really didn't seem like he did a ton, but I feel different. And when I went into the appointment today, I had a lot of pressure above my eyes, and I have none right now. I'm super relaxed, and my homework is to focus on breathing from my stomach for 5 minutes twice a day. So I'm gonna do that. All right, treatment day number 2. I'm excited for today because after I left yesterday, I was super relaxed, and I had one of the best night's sleep that I had in a long time. I had dinner, I was sitting on the couch with Jersey watching a movie, and I fell into the deepest sleep, which never happens. It was like, I have a little bit of tightness in my neck on the right, but I don't know if it's related. So can't wait to see what today's gonna bring. So let's go.
Metronome. It's an interactive metronome. It's classically used for like ADHD kids and like focus problems. All we're doing is trying to coordinating clap to a beat, and it should be easy because
Seems like it would be, right?
Because once you get the beat down,
Yeah.
you can just go at the same speed, and you don't have to try to time it up each time, right? Coordinating the emotions, the thoughts, and the actions.
How do you think I did for the first time?
Really good. I normally do in the hundreds the first time. So this is that trigeminal nerve. V3 is the branch goes down here to your teeth. This one is the one that is kind of by your cheek, and this one wraps up and goes up above the eye. And then so this is the eyebrow one that kind of takes away those headaches.
Oh, wow.
Right here is just below your ear or inside your ear, and this is where they all come together. So all of the cells are in here, but the nerves or the axons are coming out of them. And then they all come back into the brain, which is just right next door.
Wow. Right, day 3. Feeling still pretty relaxed, but still annoyed by some sounds, like the sunflower seeds at Mannon's game last night. Let's see what we're gonna do today. It's the same.
Okay.
The same.
And side,
Feels easier.
on the right.
B, D, F, H. Preparing.
Yeah, exactly.
I think this is number 5. I've been confused with how many days I've been going. Yesterday when I left, I was frustrated. At night I was exhausted, so I went to bed really early. My brain was tired, I guess. I was thinking about how kind of challenging some of these things are for me and how uncomfortable it is. It doesn't mean that it's wrong. It just means you need to push through it. If you push through it and you devote your whole self to it, then when you come out the other side, you're stronger. And that goes for a lot of things in life. So I'm just gonna focus on that and hope today is a better day. It's not as easy, but I just think you can't feel yourself as much. There was one question they're going to ask me that I was curious what your opinion was. You get the feedback, it distracts you.
I want you to say every word that starts with the letter L.
Him, round, open, some, over. Thank,
doing a perceptive motor task, you're doing an auditory task while trying to inhibit other auditory sounds.
Yeah, exactly. Yeah.
So it's going to be the same thing.
All right, that was number 5. Things were a little bit easier today. I wasn't as frustrated. I was able to think quicker and hold my balance longer. Yeah, I definitely think today was a better day. So, all right, it's day 6, or is it 7? I've been really getting all of these appointments jumbled together. It's my next appointment. Last night and yesterday, my brain was really exhausted again because I just think I'm using it in different ways. I've been having still super vivid dreams. Like every morning I remember my dream, which hasn't been the case for a really long time. So that's kind of cool. I am looking forward to doing better today. I've been doing all the homework at home, so we will see. Yeah. All right, we have 4 days left in the Neurologic Wellness Institute. 4 more days. I'm working hard. Seems to be getting better. We had a crunchy dinner on Friday and I didn't leave the table, so that's a win. All right, feeling good today. We have only 3 more sessions before we retest, so I'm excited. All right, we're back. I only have 2 more sessions to go. I've actually noticed that I'm able to manage misophonia a lot better with Jersey eating an apple on the couch and not having to feel like I need to leave at dinner.
Find the following words in reverse sequence.
All right, it's my last session of the 12 sessions, and I can honestly say like my goal before starting was that I'd like to have dinner with my family and not feel like I have to leave. And lately I've been having dinner with my family and not feeling like I have to leave. So I've been using a lot of the techniques that Dr. Nick is teaching me. It's a work in progress, not totally 100%, but I'm gonna continue some work with him till it'll just get better and better. It's my retest day, 13th day coming here, 14th day, because the evaluation was the first day, and then 12 days, and then the reevaluation. And I can honestly say that it's definitely better. And I think the goal in the beginning was to make it 50% better. And I do believe that it's 50% better. And I have techniques to manage when I'm irritated, how to not leave the situation or put my AirPods in, but to manage it and face it and not leave. Yeah, I'm really excited that I found this place. Dr. Nick has been amazing, very thorough, explains everything really well. Complex our brains are, and so this isn't gonna fix in 12 days, and I know that. But with anything, if you want to get better at something, it's gonna take some work and it's gonna take some practice, and I'm willing to put in the work. So I'm just glad that I got off to such a good start and understand my brain a little bit better, why this is happening and how I can manage it.
Every like I said, I want this normally to be around 90, which is what your first one was. Today, you don't see any movement in this line at all, and if you watch your eyes, they're rock solid.
Nice.
So that's perfect. Balance exercises, because that's important. 3 minutes in the morning, every morning, super simple. That was basically my number one for you, was the breathing. Whether you do it just simple in the morning, in and out, 5 seconds in, 5 seconds out. So the next thing would be the balance exercises or the metronome, with somebody eating behind you with some distraction. You hear it, you just take a deep breath and like put your mind to somewhere else, right? You should think that again should be just background noise. This is the gyrostim. The gyrostim is a way that you can basically activate the vestibular system in the greatest way possible. And so before I talk about this, the vestibular system is our most like foundational system. Jellyfish had it 6 million years ago, so they could tell if they were bobbing up and down or sideways. And so as we evolve, we have this vestibular system, and then all the other senses kind of pile on. Your vision, your sound or auditory, your smell, your touch, your fine touch, your pressure, your vibration, all that piled on. This is really good for anxiety and depression, because anxiety and depression a lot of times are frontal lobe, big cortical areas. So you just completed 12 days or 2 weeks of treatment at the Neurologic Wellness Institute. And the Neurologic Wellness Institute here in downtown Chicago is our second branch, our second office, that we started to expand to treat a bunch of neurological patients, because all of our doctors are Care Institute certified, and that we treat misophonia, which is very rare, so we don't get a lot of it. The first ones we got were a couple of years ago, and then it started coming in more. But we also treat our main diagnosis, our main patients are going to be concussion, post-traumatic, post-trauma or post-concussion syndrome, checking how your coordination is, with tests like this or this. We're checking your sensation. We did cardiac exam, we checked pulmonary, we checked everything. So we're looking at how the function of the brain is working with your body, and that's how we diagnose what areas in the brain need to be worked on in order to improve your symptoms. And so we find objectively what's going on and say, can we relate that to the symptoms you're having? If we can, then great. If we improve the objective findings, subjectively should also come in, and you should be feeling better. So we have these hardwired connections in the brain. They only become hardwired through habit. When you're young, you learn how to write with, let's say, your right hand. The left hand becomes super hard because it's just the habit of doing something with your right hand. That is the best way to describe how neuroplasticity works. The more that you do something, the better you get at that.
I thought that maybe I would document this journey in case there's anybody out there that is also embarrassed and too vulnerable to seek help for something in their life.